Hello, everyone. I will talk about my articles. It's factor affecting critical care nursing knowledge and practice and self-confidence regarding the glaucoma scale assessment in Saudi Arabia. My name is Mohammad Alharbi. The introduction. As we know, the glaucoma scale is a numerical tool using numbers to measure the decrease of consciousness. Also, it's communication tool between the stuff. The glaucoma scale contains three elements: the eye opening, and verbal response, and motor response. The score 3 means deep unconsciousness, and 15 means also high alert level of patient. Also, the nurse working in critical care need to have good knowledge about the glaucoma scale. The problem statement. It's possible that error in assessment may harm patients, include delayed discovery and treatment of problem that will lead also to increased mortality and morbidity. Also, severe studies evaluating the glaucoma scale of nurses and have showing there is lack of understanding and incorrect application of the vital instrument. The literature review also there is a lot of studies show there is high level of nursing knowledge will promote the accuracy in the glaucoma scale. Also, there is also study to assess the nurse practice glaucoma scale. The result was not positive conversion of the standard of practice. And the study also had measured the accuracy of knowledge and performance of glaucoma scale among the people working in the hospital, especially the nurses and the doctors. The result was 90% of the nurses answered the question correctly regarding their glaucoma scale basic knowledge. But in the clinical scenario, only around 48% of nurses answered this question correctly. Also, there is also a study about the knowledge and practice and the glaucoma scale in Addis Ababa. Also showed 51% from the nursing working in adult intensive care unit in the ICU had poor knowledge and 62% have poor practice. The purpose of my article is to evaluate the factor affecting critical care nursing knowledge and practice and self-confidence regarding glaucoma scale assessment in Saudi Arabia. The methodology, the design, I used the descriptive cross-sectional study design and the inclusion and exclusion criteria. The inclusion criteria: all nurses working in the critical care unit in Saudi Arabia. The exclusion criteria: the nurses they are not working in the ICU and not wish to participate in the research. The tool, it's contain four parts. The first part is socio-demographic data, including the age, gender, and qualification, and a lot of points. The second one, ICU nurses' knowledge of glaucoma scale using for 14 multiplied choices. The score from 0 to 8. The people who get high score, 9 or higher score, will consider to have satisfactory knowledge, and less than that, they have poor knowledge. The part 3, 6 clinical scenarios and the practice. A correct answer will get 1 point, and incorrect answer will get 0 point. The fourth part, question to evaluate perceived barriers of factor affecting the nursing to assess or to measure the glaucoma scale. The data collection was collected from 20 March to 10 April. 202 questionnaires were collected, and I used the SPSS version 27 to measure. The result, the result, the about the question, the study revealed that 48% from my sample of nursing demonstrated good knowledge of glaucoma skill, and 52% they have poor knowledge. The confidence skill, also the confidence skill, a skill too too much worked with the few nurses of duty. It's going to 95%. Also the lack of glaucoma skill. There is a lot of barriers about it. The confidence skill, also 68 or around 69% from the nurses, they have low confidence to measure the glaucoma scale, and just 31% they have confidence to get or to measure the glaucoma scale correctly. This is the correlation analysis of nursing glaucoma scale knowledge and confidence level and perceived barriers. There is positive correlationship between the knowledge and the barriers, and there is also positive correlationship between nursing knowledge about and the confidence level. The factors affecting the assessment of glaucoma skill, the most or the highest barriers was the workload and also the lack of glaucoma skill assessment tool. Or it's giving around 79%. Also, there is lack in adequate knowledge and skill, and the organization factors and the policies in the hospitals. The discussion. The discussion also the study findings are in line with previous study suggested that higher level of education correlated positively with the nurse's understanding of glaucoma skill. Also, the results are considered with those of Matter and other who found that nurses employed in critical care setting tend to possess better knowledge of glaucoma skill. Also, there is positive impact of glaucoma training of nurses, and also uh, there is some points that affect the result, like experience, the variation of a quality training, also the hair care environment. Also, there is uh, nurses who identify a greater number of barriers demonstrate high level of knowledge. This is very important point. Also, there is the nurses in intensive care unit showed higher odds of possessing good glaucoma skill knowledge and reflecting that impact of clinical exposure comparing with the other departments. The conclusion, in conclusion, 48% they demonstrated good glaucoma skill knowledge, and there's 23% exhibited good practice by correctly identify the glaucoma skill. The recommendation of the future research on the same topic. A similar study can conduct on a large sample if they will use large sample better to get more specific result. Also, can assess the factor affecting critical care nurses like knowledge practice and self-confidence before and after after the educational program. And thank you to listening to me.